For this video, I will talk about epidemiological study. For the epidemiological study are divided into two types. The first type is observational study. The second type is analytical study. Which first one I'm gonna talk about observational study. The observational study divided into two types, which divided according to the method study and period study. The observational study including two. The first one descriptive study, the second one analytical study. Let's see for the descriptive study. The descriptive study divided according to the method study is a study of frequency of the disease, incidence and spread of disease in different communities, or it can also study the nature of disease incidence in subpopulation within the same community by enumerating the phenomena occurrence according to the nature, person, time and place, as well as the distribution pattern of the disease according to the characteristic of the geography, time and age group at risk population to be studied. Which descriptive study divided according to the method of study 5 as following. Number 1. Ecological or correlation study which interests all population. 2. Case study or case report which interests individual or patient. 3. Case series which interests individual patient. 4. Cross-section descriptive study which interests individual demographic. And 5. Surveillance study which interested individual demographic. And then I'm going to talk analytical study. The analytical study was designed to test the hypothesis about factors, the determinants of disease, containing exposure to risk factor or cause of disease, which including 4 as following. 1. Cohort or incidence study which interesting individual population. 2. Case control study which interesting individual population. 3. Cross-sectional or prevalence study which interesting individual population. And 4. Disease investigation which interesting individual population. Let's see information sites about descriptive study. 1. Correlation study. Correlation is study in a represent a segment of the entire population to describe the characteristic relationship of the distance with the factor to be studied at the population level, such as age, season, behavior, health. In addition to describe in the problematic situation, also search for the relationship of variable by 1. A comparative study was studied into similar population to see if the factor suspect is affecting your status of interest who study different or not. 2. Correlational study uses statistical analysis technique. Is there a relationship in what direction and what is the size of the immunity? Figure 6.1 graph shows the relationship between the incidence of AIDS and incidence of tuberculosis. Let's see number 2. Case study. Case study are studies that describe a single patient. People with disease or abnormal health condition are often in people with a disease that has never been seen before. It is a disease that is new, acute, rare. By following up, observing signs and symptoms, diagnosis and treatment until the end of treatment results. The result of the study can lead to new hypotheses. As an example, in the early 1970s, there were reports of birth defects in newborn. The hand and feet were stumped, and the body had an abnormal king. When questioned, the mother's pregnancy history. The history of suspected information was obtained. During pregnancy, a drug was taken. It is a new drug that has just been released, containing a drug called thalidomide, found to be a potential carcinogen substance, especially to embryo tissue. Next, let's see number 3, case series. The case series is a collection of several case studies encountered in a short period of time, or risk factor for disease lead to assumption. As an example, C. and Johnson study 1974 report 3 cases of young men receiving treatment at approximately the same time was diagnosed with liver cancer, hepatic angiosarcoma, which is a rare disease in the people and is difficult to find in young people, being an employee working in a vinyl chloride factory. Although there are only 3 patients, it's a rare disease. The percentage of disease occurrence found in this time is much higher than the information that should be. The research team therefore assumed that it's likely that a new epidemic has occurred, and its hypothesis that exposure to vinyl chloride from professional work to be done is a risk factor to the incidence of liver cancer later. The researcher conducted additional analytical study and results that confirm that the supposed hypothesis is true. Next, let's see number 4, cross-section survey. A cross-sectional descriptive study, also known as prevalence survey. This type of study provides information on the frequency and nature of the disease in population at any given time. Isn't information that helps executives to assess financial status. For example, a cross-section survey to determine the prevalence of heart disease among white male farm owners aged 40 to 74 years, classified by daily activity, is shown in the table 6.2. Next, number 5, retrospective descriptive study. Retrospective descriptive study. These are retrospective study based on secondary data which has already been collected and brought analyze the basis of the pattern and nature of birth, the distribution of the disease of interest to study, such as a study based on a retrospective medical record review, past illness history, physical examination tests, and laboratory tests. Next, 6. Surveillance study or prospective descriptive. Descriptive, also known as disease surveillance, is the observation of the occurrence of the disease and distribution of the disease in the population, including related event or case with the increase or decrease of the disease, which the observation must be done continuously and consistently in a manner that monitors the incidence of the health event of the target population, continuously monitoring to help detect abnormality in a timely manner. Vigilance will tell the nature of the distribution of health problems, including the factors suspected to be the cause of health problems. Next, I will talk about analytical study. The analytical study, there are 3 main objectives of the analytic study. First, to analyze the cause relationship or factor suspect to be the cause of the disease. 2. To indicate the risk or relative risks of disease occurrence, such as the relative risk of disease incident in the cohort, prospective cohort study, or relative of the disease incident in a retrospective study, the study control group, and the And the last one to serve as guideline for providing health education to the public to reduce the risk of disease education. Analytical study consists of 4 according to method study. 1. Cohort study, which study unit in individual demographic. 2. Case control study, which study unit is in individual demographic. 3. Cross-section or prevalence study, which study unit is individual demographic. 4. Disease investigation, which study unit is individual demographic. For the analytical divide according to period. First, cross-sectional study focus on points, period prevalence, study unit, which study unit is individual demographic. 2. Retrospectives or case control, study unit with individual demographic. And the last one, prospective cohort or longitudinal study, study unit with study unit is individual demographic. Next, I will talk about the cohort study or prospective or retrospective cohort study. A cohort study was initiated to monitor from a group of people who have something in common, such as born in the same year, same class. Therefore, the group and the initiated this study is called cohort, and this type of study is called cohort study. A historical prospective study is a study that has happened sometime in this past, but the effect or disease has not yet occurred. The study will continue to monitor in the future until the disease appears and measure the incidence rate of the disease. Incidence rates analytical prospective study may be divided into 2 types, namely it can be both prospective or retrospective study, focusing on the exposure to pathogen factor that it does to be risk factor for that disease. By starting the study in normal people, both groups will compare between those exposed to risk factor suspected of causing disease exposure and those who were not experience that risk factor non-exposure with related disease occurrence during the study period. From the table 6.5, the point has been determined as follows. Exposure and cause disease instead is it A. Exposure but not a disease instead a variable. B. Non-exposure but disease is instead a variable. C. Non-exposure and not disease instead a variable. D. And then bring the variable A plus variable C to the case of disease and bring variable B plus variable D to case not disease and bring the proportion of touch by using A divides A plus C with disease and B divides B plus D to find incidence of disease. Next, let's see an example from the table 6.6. After instead variable, you can calculate the incidence of disease or the occurrence of disease in both groups as follows. 1. The rate of disease among people who experience risk factor is equal to after instead variable can calculate the incidence of disease or the occurrence of disease in both groups as follows. 1. The rate of disease among people who export risk factor is equal to A divides A plus B, and 2. For the occurrence of disease in another group is a group that does not exposure, the incidence of the non-exposed group. IO O equal without exposure, which is equal to C divided C plus D respectively. Therefore, if there is a true relationship between the exposure of disease and the disease should be found clearly as shown in the picture. The cohort study used a comparison of the ratio of the different risks of disease, also known as the relative risk of the disease, which has the following calculation. Relative risks, or the occurrence of the disease in the group that exposure disease factor, or IE, divides the rate of disease in the group that does not expose the disease, or IO factor, and then formulate relative risks is a ratio of the group that have been thought to be the cause of this disease per group that does not receive the thing that should be the cause of the disease. Next, number 2, case control study. Patient group control group is a comparative study between study group patient with disease called case and control. In this case, a group without disease exposure that is thought to be a risk factor for the disease, starting from the effect to cause hypothesis about the cause of the disease or problem are proven, or to test for correlation between the determinant and the incidence of disease or health problem to find risk factor that have relationship with that disease or health problem direction from effect to cause. Therefore, is it called a retrospective study? An analytical retrospective study of patient or control was divided into 2 subtypes. 2-pair study were studies that use matching method to manipulate variables or factors suspected of influencing their associated with disease or health condition, so that those variables had the same characteristic. From the table 6.3, shown design and case control study to determine variable as follows: exposure and disease. Instead, variable A. Exposure but not disease. Instead, variable B. Then, non-exposure but disease. Instead, variable C. And then, non-exposure and non-disease. Instead, variable D. Bring the variable A plus variable C to the case of disease, and bring the variable P plus variable D, and bring the proportion of exposure by using A divides A plus C with disease, and B divides B plus D. In this type of study, analytical case control will have the following calculation and sample shown in the table 6.4. Find the size of relative. In previous study, we use a relative risk measure called odds ratio or OR. From table 6.4 can calculate the odds ratio as follows: OD equal A times D divides B times C. For calculating the magnitude of the relationship in an analytical retrospective study for patient, case, or control, a relative risk measure called the OR was used using the formula. And then when substituting the value from the data in table 6.4, we get the magnitude of the relative. Next, number 3, cross-sectional or prevalence survey study. Cross-sectional study or prevalence study is also called the disease prevalence survey. This type of study provides information on the frequency and nature of disease in a population over a specific period of time. For the table 6.7, shown design of cross-sectional study, which insists variable as follows: A. Exposure and disease. B. Exposure and non-disease. C. Non-exposure but disease. And D. Non-exposure and non-disease. For the total, bring A plus C of the disease and bring B plus D of non-disease. As an example, table 6.8. Let's see the topic 2, experimental or intervention study. Experimental study into two types as follows. 1. Randomized control trial or clinical trial study. 2. Community or field trial study. Let's see clinical trial. The clinical trial is design and conduct of randomized to evaluate the effect of early prophylactic agents such as vaccination, as well as to evaluate the effect of healthcare of the population in the community, such as disease screening or surgery for patients. Although the specific circumstance of each trial may differ depend on the trial goal, the method and fundamental principle remain largely the same. Type of clinical trial. There are 3 types. 1 type is talk about experimental to cure. 2. Disease interventional trial. 3. Experimental to prevention disease. The table number 6.9 shown type and example of clinical trial study. So that's it for the epidemiological study. So thank you for attention.